Hi, my name is Dr. Parky. I'm a clinical psychologist licensed in the state of California as well as the province of Ontario. And today I had a neat little idea to actually rank the different therapy techniques that I use with patients in terms of how useful I think they've been and how much of an impact they have on people's lives. So before we jump into it, I really want to highlight that this is all in good fun. It's not meant to be taken super seriously with all the empirical literature and science out there. It's just based off my own experience. And I want to qualify this with two things. Number one is that different techniques work for different people. For some people, they might see a lowly ranked technique and be like, actually, that works super well for me, which in this case, that's awesome. And I would encourage you to keep using it, or vice versa. The things you see as like super highly ranked, you might be like, but that doesn't really work super well for me. In which case, again, totally cool. Pick the ones that work well for you. And number two, when it comes to actual therapy, like cognitive behavioral therapy, we use a mishmash of all of these different techniques together to be able to support your fulsome well-being based on what we understand that maintains your problem. So again, these are not strategies meant to be used solely in isolation. You can absolutely combine them together. Again, this is all just in good fun. Okay, so the first strategy that I'll talk about is evaluating the evidence, which is a very common technique used in cognitive therapy, where we're basically looking at a statement like, I'm a loser, I'm a failure, other people hate me, and checking the facts of that particular situation like we do in a court of law. What are the evidence that supports that thought? What is the evidence that does not support the thought? And be able to come up with a bit more of a balanced thought afterwards. So the evaluating evidence strategy, I would probably put in B tier. It's a pretty good strategy. For some people, they find it quite helpful to kind of look at their thought and be like, actually, I don't really think that thought is true. But the reason why I don't necessarily put it higher up is that for some people, they recognize and logically understand that thought, I'm a loser, or that thought, other people hate me, aren't necessarily true, but I just can't change the emotion of it. So as a result, even though they know that fact logically, they can't sort of disentangle it emotionally, so it has less of an impact on their overall well-being. So for some people it can be helpful, but other people, they may need other strategies to be able to actually quell their anxiety as well as their distress. And the other thing then evaluating the evidence that can be a little bit tricky is that some thoughts can actually be quite true. Like in the context of trauma or chronic pain, it can be almost kind of invalidating for a therapist to try and change that specific thought when they're like, well, wait a minute, like my trauma, like that did really affect me, or the chronic pain, it really does affect me. So why are you trying to tell me to change my thought? Again, a good therapist will be able to work through that in a way that feels really effective, and it can be kind of still a vulnerability when you're trying to change a thought that has a good amount of validity to it. Okay, a second strategy I'll talk about is general relaxation strategies like, deep breathing or guided imagery practices, things that are meant to kind of generally reduce your anxiety over the long term. And this one I actually don't love all that much, and this is for a couple of reasons. Number one is that a lot of people aren't able to do it in a consistent basis. They're offered the relaxation strategy, they take it, and then they're like, I'm kind of too busy for it. And then as a result, they don't engage in the practice, and it's not necessarily something that they can really practice and play with in that particular moment. It's hard to kind of turn on a YouTube video and do a 5-minute meditation before you go into work or things like that. It just becomes a little bit harder to practice, and it's not directly related to a specific event. So as a result, it becomes something that people don't always do, and it becomes hard to pull on during actually stressful situations. So in that case, I would actually rate relaxation strategies a C tier. It's honestly super effective if you can do it on a day-to-day basis, but for most people, it becomes a bit tricky to pull on. Although I don't love the idea of general relaxation exercises, I do love the use of distress tolerance strategies to reduce or manage the fight or flight response when our emotions become very, very overwhelming. Like for example, we're in a crisis situation, so we need to engage in something to kind of combat the physiological response, like for example, splashing your face with some cold water, or doing some intense exercise or paced breathing, whatever that might be for you. That can be a great way to reduce the physiological response. So you can take that 100 out of 100 on the emotional thermometer and bring it down just enough to then engage in proper problem solving and doing all the things that you need to do. So in this case, I would actually put distress tolerance skills, the ones that you use during crisis situations, in the B tier, where it's a very strong skill that helps us to not make life worse, but it doesn't necessarily make your life better, because you still need to engage in additional skills and things that you need to do to be able to cultivate your own life worth living. So the next strategy I'll talk about is exposure exposure therapy, which is kind of the bread and butter for different anxiety and phobia related disorders, where essentially we're saying that oftentimes I'm afraid of this thing, like planes or social situations, and I always avoid them. And that maintains my anxiety in the long run, even if it reduces my distress in the short term, because my brain never gets a chance to habituate or learn that these situations aren't as scary as I think. And exposure therapy can be incredibly helpful, especially for treatment of phobias and other types of anxiety related disorders. So I would actually put this one in A tier. It's a very powerful skill. Basically, it's as simple as facing our fears, but being able to do that in a systematic, gradual way where we start with things that are challenging but manageable, but make our way up the hierarchy. That can be a fantastic way to be able to face our fears, learn that things are not as scary as we think, or that we're more resilient than we think, and be able to reduce anxiety overall. So the next strategy I'll talk about, the fifth one, is mindfulness. And mindfulness, I think, is an incredible adjunct to typical therapies like cognitive behavioral therapy, because instead of focusing on whether the thought is true or not, or changing our emotional responses to make us feel more relaxed, it's about changing our relationship with experiences in the first place, to recognize that a thought is just a thought. An emotion is just an experience of different physical symptoms. And for us to be able to look at it like an observer in a curious, dispassionate way, that just changes our relationship with bad experiences in a very fundamental way. And when we can kind of just engage with life in that sort of much more non-judgmental, present aware way, it really can lead to really expansive changes in the way that we experience life, being able to enjoy life for what it is and not turn pain into suffering. It can allow us to be much more present with the facts of reality so that we're able to say, okay, this is what's going on right now. Being mindful, this is my goal and my values here. What are the behaviors that are going to be most effective to reaching my goals? So for the people who are able to cultivate this sort of mindful perspective, I really do think it can have very profound impact in our way of experiencing life, such that I would put mindfulness in S class. And one thing to keep in note is that mindfulness is not about necessarily making me more happy. It's not necessarily meant to make me more relaxed. It's really just about being able to be attuned to what's going on in my environment, as well as my inner being, my thoughts, my feelings, my physical sensations, in a way that is truly non-judgmental, in a way that doesn't turn, again, pain into suffering through our strong negative reactions to uncomfortable thoughts or physical feelings. So the sixth skill that I'll talk about is behavioral activation. And fundamentally what behavioral activation for is that it's a treatment for depression, where depression basically, when we have low motivation, low mood, we stop doing all the things that we actually enjoy. And this becomes a reinforcing cycle of depression where we stop doing things, we feel even worse. We stop doing things, we feel even worse. And behavioral activation is all about saying, wait a minute, what are the things that give you joy, meaning, social connection, pleasure, mastery? How can we reintegrate that into your life so that we can break this pattern? And I think behavioral activation is a really powerful strategy because oftentimes we often think how we feel should impact what we do. If I'm tired, I'm going to go rest. If I'm sad, I'm going to withdraw. And what behavioral activation says is, wait a minute, let's do and then feel. And oftentimes you might have noticed yourself, like you really didn't want to go that walk, but your dog tells you to go anyway. So you do go and you feel better afterwards. So in this case, you acted first, then you felt second. So personally, I would put behavioral activation in A tier. Obviously, as a therapist, you need to work with the patient to meet them where they're at, to be able to properly integrate these strategies back into a person's life. But when you are able to do so, these things can absolutely play a big role in breaking the cycle of depression and getting the person back on track. Okay, so the next strategy I'll talk about is problem solving. So as the name suggests, problem solving is pretty simple, where you identify a problem, like next week you are going on a vacation with your wife and you need childcare before then. So you're going to come up with all the possible solution and then pick the best one and see what happens. In this case, I personally don't think problem solving is that incredible of a strategy. Most people will probably know some semblance of problem solving. So I would personally put it into C tier, mainly because the main issue most people have isn't necessarily coming up with a solution. It's about exacting and actually doing the thing that they plan to do. So I don't actually think by itself problem solving is that amazing of a strategy, but it can definitely be augmented by the use of something called SMART goals, which stand for specific, measurable, achievable, relevant, and time-bound goals where you're essentially making something a little bit easier to actually engage in by understanding what are the specific ways that we can get to this particular outcome. Because oftentimes the problem, again, doesn't lie in the solution, it comes from addressing the barriers associated with doing that thing, and then also exacting a specific strategy to be able to apply that strategy into your life. So the use of SMART goals can break something big into something a bit more specific so that you can are more likely to actually accomplish it. And the last strategy I'll talk about is the behavioral experiment, which is actually one of my favorite strategies, where essentially the idea is that our minds are constantly making negative predictions. I'm not going to like this is going to go wrong. And the behavioral experiment basically says, let's be a curious scientist and test that specific prediction. So for example, you might have a prediction, even if I were to call that old friend up, they're going to say no to the hangout, or if I were to try out that new restaurant, I'm not going to like it. So what the experiment says is, okay, well, you made a prediction, let's be dispassionate scientists and see what happens. Let's run the experiment. And what we often find is that our negative predictions, our worries about uncertainty, they're usually unfounded. Like, we thought this terrible thing would happen, probably didn't go that way. Or let's say even if it did, you showcase to yourself that you were resilient enough to cope. And I think it becomes a win-win in that way to recognize that uncertain things doesn't always mean bad. And even when it does, I'm a resilient enough person to handle it. And that becomes a very important lesson because life is full of uncertainty. So you need to develop a sense of resilience to be able to say, and that's okay. So I would personally rate the behavioral experiment in S tier. And remember, this was all in just good fun. It doesn't necessarily mean that because I rated something S tier, it has to be that incredible for you. You can kind of decide based off your own understanding as well as your own experience, what are the strategies that are most helpful for you. As well, these are not the only strategies out there. They tend to be more the common ones in cognitive behavioral therapy, but there are a lot of different modalities with their own mishmash of different strategies. And again, you can apply more than one in various situations to be able to really become your own effective therapist. So again, all in good fun. I hope you found it interesting and learned something out of it. And I'll see you in the next one if you're interested. Bye-bye.